My name is Nabil Seda. I am the director of the Laboratory of Biochemical Neuroendocrinology at the Clinical Research Institute of Montreal. From the 1970s, it was realized that proteins, active proteins, are not synthesized originally as active proteins. They have to be cleaved to make active proteins, so that you need convertases, which are enzymes that cleave them. They're proteases. Okay, so that's why it became proprotein for precursor, convertases, PC. And then when finally in the beginning of the 1990s, we began to clone and identify the enzymes that are responsible for such cleavage, we realized that they are related to a bacterial subtilisin and to yeast enzyme called kexin. So that's where the name comes from, is proprotein convertase subtilisin kexin. And there are 9 members. 1, 2, 3, 4, 5, 6, 7, 9. Number. So PCSK7 was discovered in my lab and cloned in 1996. So you see, quite a number of years before we began to understand what is its functional and what is its possible implication in clinics. It has just recently been realized that PCSK7 could play an important role in the development of fatty liver disease and in the regeneration from fatty liver disease. PCSK7 was thought that it is expressed in many tissues, including the brain, and we showed that if you do not have PCSK7, you lose anxiety. Okay, so that was a connection between anxiety and metabolism. So we then realized that maybe it is playing a role in the liver. And when we saw that, we did some genetic studies and showed that there is a connection between the levels of PCSK7 and the development of fatty liver. And that gave us the idea that maybe manipulating the level of PCSK7 may help in solving the difficult problem called non-alcoholic fatty liver disease. And we realized that removal of PCSK7 expression is not enough to prevent the formation of NAFLD, but rather it's fantastic in allowing the regeneration of the liver from the insult of NAFLD, so that we can actually cure, hopefully on the long term, patients who have early stage NAFLD by removal of PCSK7. Obviously, we would love to extend this work to human. The next step is to use what is known as human cell lines at the beginning, and then what we call organoids, which are organs outside of the body, human organoids. So we would like to test now our approach, which is this silencing of PCSK7 expression on these organoids as a first step, what we call a clinical trial at some point.